ahead and record it now. Why don't you first of all just kind of introduce yourself and kind of explain how you got involved with Who We Play For?
Okay, well, my name is Junaid Ahmed. I'm a cardiologist. I work with cardiac vision and cardiology therapeutics. A lot of what I do is post-acute cardiology, and I'm also a sports cardiologist and a medical advisor for NCAA for a couple of conferences, and work closely with the University of North Florida and Jacksonville University and a couple of other universities around the area. What was the question, Molly?
So I was kind of asking, okay, so that's a little bit about you. How did you get involved with Who We Play For?
Oh, okay, so so my background was sports cardiology. I actually did some training with some sports cardiologists during my fellowship, and I knew this is something that I wanted to get into, and especially a lot of the sports cardiologist studies and things of that nature were done in Europe. So I was kind of looking for a niche here in the States and trying to figure out. And I think it was about 3 years ago or 4 years ago that ACC actually recognized sports cardiology as a niche. And I went to the conference and met a lot of cool, neat people that were starting to do the same thing that I was and kind of interested in it. So as I was trying to figure out where I was, I met Evan with Who We Play For, and he did a lot of cardiac screening, and was an idea that he wanted to do, and I loved it. So we kind of came up with the cardiac screening and Who We Play For, and how I can help him out with the cardiac screening, and that's how I actually got involved with Who We Play For. I completely understand there's cardiac screening and sudden cardiac death. It's a lot of controversial issues. It's a huge debate. However, I do feel like we do make a significant impact. Sometimes things are not all about numbers. And with the whole cardiac aspect of it, more than the sudden cardiac death component of it, I was actually interested in conditioning with athletes. For example, why some athletes have a tougher time conditioning, or why some athletes are not progressing in practice, or may have some cardiac symptoms that may be overlooked. And I just wanted to be that kind of referral source for any kind of school, high school, for sports, given what I do. So that's kind of how I got into it.
Absolutely. And that was going to be kind of like my next kind of follow-up question is, and you touched on it right there, is, sometimes it's not all about the numbers. It's not how far you go. And I was going to ask you, what did you really see in this organization's mission that really meant something or stood out to you?
Well, first of all, it's with any kind of practice or group that you want to be part of, you want to make sure that you're working with the right people. The mission is important, but sometimes I think it's most important is the people you work with. You want to see that the people you work with will carry out that mission, right? So a lot of times you're part of a group or practice or a team even, and it's very important to work with people that you like and people that you kind of see where you can kind of grow with, and realize that this can be something. So when Evan started, I know that it was tough. It was really tough trying to figure out exactly how to push Who We Play For into getting into, like, not only just high schools, but at the same time, like the colleges and the community colleges, things of that nature, and try to let them know that there is a service out there that is looking out for sudden cardiac death in athletes. And when I started doing this, I wasn't just even looking at not even professional sports. I was more focused on student athletes, because I know there is an incident for sudden cardiac death, and trying to figure out ways I can help whether it be colleges, whether it be universities, but even going down to the recreation level. Like, you'll see me volunteer in a lot of local events, a lot of 5Ks, maybe even some of those Spartan runs, things of that nature, because I feel like, every park, every place, especially when we have athletes competing in any sport, we should have like defibrillators. We should have access to medical care and make sure that we do everything in a safe environment. And Evan and the others that were with us had kind of like a very similar vision. It wasn't really just about, let's go screen skids and try to prevent sudden cardiac death. It was the mission is a lot bigger than that. It's basically tying everyone together that have similar vision in terms of trying to take care of athletes, not just from a cardiac standpoint, but just overall with everything. If there's anything that we can do to make an athlete more successful or prevent obviously sudden cardiac death or make any type of impact for them, whether even down to like internships, volunteering, things of that nature, it all kind of combines together. So we were looking at multiple angles, not just one thing.
So kind of going off of that now, one of the things you just kind of talked about is, really working with the athletes, on different, preventative measures, things like that. I mean, with all the students, whether they are in the North Florida, like colleges or high schools or whatever, what is one thing that you really kind of urge to them to, make sure that they are keeping themselves alive and thriving to ensure that, nothing bad happens to them?
Yeah, that's a great question. So the number one thing that I can advise or recommend student athletes or recreation athletes or any kind of athlete is just to listen to your body, right? I mean, listen to any kind of symptoms you may be having, listen to things that, pay attention to those recovery days, more or less, pay attention to anything that you feel like, potentially can be limiting you from actually, progressing, or it could hamper you from actually not being able to perform at your peak level. So when you listen to your body, definitely, especially for your student athletes, there's so many resources out there. Use your athletic trainers, use your whole medical team that's out there to see if there's anything else that needs to be done, and play it safe. More than anything is because, this is a long-term game. It's not, one thing that, athletes need to figure that out is that, it's definitely, you're working for a purpose and a goal, but not everything should be a sprint, right? I mean, hopefully you'll be playing the same sport or sports in general for a long time. So if there is any issues, I would just say, just listen to your body and then make sure you go to the right people, because you have a lot of resources for you. And one of the biggest things that we're doing this now is just to make people more aware that there are people out there that are willing to help. We're kind of there to see if there's any advice, that we can give to make them one step closer to their goal.
Absolutely. So now let's talk about what I'm sure everybody in the medical community and everybody in the world has been talking about for the last 6, I think it's actually 7 months now, the pandemic with COVID-19. I mean, obviously a couple things have come out regarding student or just athletes in general with COVID-19. I mean, from your guys' perspective right now, how does it, I guess, put athletes at a greater risk for heart problems that you're seeing?
So remember, I deal with, from the elderly to all the way to, student athletes. So it's a little bit different depending on the age level and exactly your functional capacity. Now, just honing in on student athletes, one of the biggest things that I really need to stress is that every athlete really needs to, at this point, take care of themselves and kind of watch for symptoms of COVID, right? I mean, your symptoms are fever, nausea, vomiting, diarrhea, loss of taste and smell. So that's the biggest thing that I really want to take home on this one is, remember, this is a very contagious disease, and you have to be really aware of those signs and symptoms, because one, to protect yourself, but also to protect your teammates and your friends and colleagues as well. With that said, though, once someone contracts COVID, most of the student athletes we're talking about either high school, college, or maybe even the junior high school level, it's not more, we don't see a lot of mortality, although it does happen, mortality meaning death, right? So that can happen, but it's a very, very less and significant amount compared to the elderly. However, most of, in this age population that we're dealing with, student athletes, they usually have a lot of symptoms, and the question becomes, how long do these symptoms last for, and exactly what are the complications of COVID? Now, from a cardiac standpoint, it's huge. So when I'm dealing with the elderly, it's a little bit different because, there are more issues such as clotting. There are issues of, like heart failure, arrhythmias, things of that nature. In student athletes, ranging from junior high to college or Division I sports, even to professional athletes. One of the biggest things that we're finding with COVID is that we about 70%, some studies like from Germany say 80%, usually have cardiac complications like myocarditis. That's becoming even more common an issue with COVID-19, especially post-COVID. After those symptoms resolve, exactly how long does the risk of having cardiac event last for? The answer is, of course, we don't know yet, but we are gathering data in terms of, what the future prognostic and complications factors from COVID will be. And those complications could be arrhythmias, right? Arrhythmia meaning like it could be atrial fibrillation or SVT, supraventricular tachycardia, or even ventricular tachycardia, and heaven forbid something, an arrhythmia could leading to sudden cardiac death. So with that said, we don't know exactly, but again, just listen to your body, pay attention to the symptoms. I would highly recommend that you see us in clinic, especially post-COVID. We've been having students see us in clinic post-COVID because we want to make sure that they don't have issues like arrhythmias. We've been checking EKGs. We've been also doing echocardiograms to make sure that their heart functions normal, and to make sure that there's no kind of structural abnormality from the heart. And most importantly, exactly their symptoms, whether or not they can go back to compete at a higher level. Now, so far, I think between two universities, I've probably screened close to about 100 student athletes right now. And I would say, a handful of them, even 4 weeks out are still experiencing symptoms where they can't even run a 50-yard dash, because it's just that bad and it's just that severe. The one thing I am finding is that if those students that do have predisposed conditions like exercise-induced asthma or any type of asthma or any type of lung issues, they're struggling a little bit more than suppose a student athlete that doesn't have any kind of predisposed condition. But then I'm also having, some student athletes, you've got those, football players, basketball players, where even baseball players, like they're very well conditioned. They have probably like less than 10% body fat, but and they perform at a higher level, but they still cannot go back to that peak performance right away. And my recommendation has been for every athlete is that one, the symptoms have to resolve before you can go back to play. And if the symptoms have resolved, then you should gradually, I've talked to many athletic trainers where they're gradually progressing them to go up to their peak functional capacity, where they're able to compete at that level. But before then, it's about 2 to 4 week time period where actually, they rather push them, progress slowly until they can do it. But especially now, the two things I do want to recommend highly is to make sure they're hydrating, right? A lot of times electrolytes are a big issue, especially if you're especially exposed to arrhythmias on top of COVID. And so dehydration is a big issue. So always hydrate yourself. Number two is sleep, especially with student athletes, your body needs time to recover. Some days you can get by with less sleep, but overall, if you want to get the maximum out of your practices and things of that issue, like you definitely need sleep. And you have to remember, every coach, when you come in, they expect that you've been doing those things already, right? And not every practice is going to start off with like, did you sleep, or how much water did you drink, what are your habits like? So that's something that, every athlete has to, especially nowadays, make sure they're on top of their health and make sure that they listen to their body and kind of go from there. So with COVID, there's not many answers, but a lot of it is basically the things that we've been kind of encouraging all students athletes to do all along. And now it's just, we're pushing it even harder to make sure that happens.
Absolutely perfect. That was a good reminder to me because I just worked out and everything because I need to go drink water. I have not
Yeah.
drank enough water today.
Yeah, you can, I mean, with dehydration, like if especially with COVID, you know, you're just exposing yourself to a lot of arrhythmias, you know, cramping, because remember, COVID is a systemic process, right? It takes over all your body system. It can completely drain you. So hydration is key.
Absolutely perfect. Well, I think those are all the questions we had for you. Actually, our last question is we ask everybody that we have on to this little kind of show thing is obviously our name is who we play for, and we all kind of have a reason and why we get up every morning and we do what we do. We do the good fight. So we want to ask you, of course, who do you play for?
For like what kind of sport I play for?
Like, no, like, okay, do you like, so for Evan and them, like, those guys who started this, they started it because of Brave. And so they say, you know, we want to go out there and save lives because of Brave. Some people say, you know, they do it for the athletes who couldn't and stuff like that. So why, I guess, did you want to, I mean, we know why you want to get involved with who we play for, but what is the reason why, I guess, you think this is a good fight?
Oh yeah. So my number one thing, whether it be if I'm dealing with the elderly or if I'm doing with student athletes, it's for me, it's always been about increasing conditioning and functional capacity, because no matter how many meds I can push as a cardiologist and have all these like technology in terms of placing valves and things of that nature, all of our prognosis and all of our great results have, at the end of the day, reflected on someone's functional capacity. So if you have a higher functional capacity, there's a good chance that you may not have diabetes, you may not have hypertension. And as an athlete, you know, if you can, if you're very well conditioned, right? I mean, at that point, I just feel like, you know, any kind of game you participated or event you participated in, like, you know, that's there. Now you're just kind of processing and increasing your skill set more than anything. So for me, it was always about, you know, functional capacity and conditioning.
All right, perfect. Well, there